name is Stephanie Dorwart, and I am the owner and CEO of Altius Healthcare Consulting Group. Today, I am joined by a guest that embodies everything that you can do within the spirit of healthcare leadership, especially in the rural market. Craig Saylor began his career at the Bedside as a respiratory therapist. He then really got the bug to become a leader and started to really focus on what he needed to do to move up. Then he's going to tell his story because he can do it much better than I do, but I have a deep respect for everything that Craig Saylor embodies. He climbed the leadership ladder, serving as a CEO. He served as a COO and advisor, and really built a career focused on rural healthcare and building high-quality organizations with very strong results. And then at one point in his time, he decided to also then become a minority owner in a hockey team, and we're going to talk through that. But Craig, welcome to the show. Thank you so much for being here. And if you want to take a minute or two to share a little bit more about your history that I did not, love for you to do that.
Thank you. Thank you for the nice welcome, Stephanie. And it's a pleasure to join you on the podcast. So became a respiratory therapist in the early 80s, and that really grew out of a time in my life when I was hospitalized when I was 16 for pneumonia. And so I spent a time in the hospital being treated by respiratory therapists, and that kind of always stuck in the back of my mind. So when I hit a certain point and an opportunity to enter the field for training, I did. And that's grown, as you mentioned. I'm really a strong advocate for rural healthcare. And I think that really came out of my early experience in as a respiratory therapist and treating patients in the hospital as well as in the home, and just understanding all the possibilities that could be in rural healthcare, as well as the limitations and how we could overcome those.
Yeah, I think I know that we share the passion for rural healthcare, and with everything going on today, I'm very inspired by your rural healthcare journey. And if we can, go back in time a little bit, whenever you were at the bedside, we work with a lot of early healthcare leaders that are maybe in, their first 5 or 10 years of their journey. And at some point, you determine that you want to do more. Can you go back to what, that first inkling when you were at the bedside that you thought, maybe I might want to be the manager or the director, or how did that evolve?
Sure. And I think the opportunities that rural healthcare provided during that era, and to some degree still do, we were a very small respiratory department. So we would have on-call coverage, from 11 p.m. till 7 a.m. Because of the proximity I had from the facility to my home. I would end up sleeping there. So I would sleep there probably about 5 nights a week. When I would cover the 3 to 11 shift, you were all alone on many of those shifts, just because of staffing size. And so you had, a lot of time to interact with nursing, with other allied health, as well as physicians. And I think you see it from a different perspective in a community hospital when you're wearing many hats. In those off hours, what is really needed for patient care? We have those collaborative events as they still occur now in break rooms, and everyone comes up with some really good ideas there. And it's implementing those ideas that I think were really kind of a driving force behind me wanting to evolve our department to something different than what it currently was. And I think that led to, a leadership role. Did I ever apply for a leadership role? No. I think those all just evolved as time went on. But I've always had an interest in changing the direction or influencing decisions and outcomes in the department.
One of the areas we sometimes see new leaders struggle is the ability to shift into vision and strategy and go from just the operational side of things into understanding what the big picture looks like. What was that like for you, moving from, doing the bedside day-to-day operations to going into and now being responsible for the CEO perspective?
Well, I was always very blessed by having medical directors that I worked with that were very visionary. Many of them were my age at the time, or just a bit older. So we shared many of the same same ideas for what healthcare could become, what respiratory or cardiopulmonary patient care delivery models could or should look like. So I think that was a true blessing for me that I had strong medical staff involvement and leadership that helped maybe take my ideas from trial balloons or break room talk or even just mental imaging to actually to the physician level and how they could roll out and impact patient care.
Yeah, and I think when you're talking about like having those types of leaders and mentors and the medical professionals, mentors are so important in all of our careers and all of our aspects because they really provide that, I'd say, blueprint for you to continue to guide your work and develop. And I know in my career, mentorship's been extremely important. I would even consider, you one of those mentors, working in the consulting field and working with clients. We've been in contact for a long time, but our paths first crossed leading at Somerset Hospital. And if we can sort of go back in time a little bit, I think the transformation of Somerset would be extremely important to other rural healthcare leaders right now, because we're sitting at a point in time where if you look at any of the news, the numbers are anywhere from 650 to 800 hospitals across the country that are in danger of closing immediately. And many of those are in rural setting. And I know whenever our paths first crossed, I think we'd both be fair to say that there were individuals in the Somerset hospital community that thought that might be a potential future for the hospital whenever it was losing $2 to $3 million a year. I think at some point it may have even been more than that. So can you take us back in time to what was happening in Somerset at that point in time and sort of walk the listeners through a little bit of that transformation?
Yeah, I'm sure much of this is very well documented within the communities of healthcare, but Somerset Hospital, unlike not unlike other uh, rural healthcare communities, faced the challenges that we all do: staffing shortages and medical staff shortages. Uh, presses for uh, capital equipment, legacy costs. So those were all things that were quite apparent. But we also, at the same time, knew we really didn't have a relative benchmark model for various financial expenditures, and the biggest one being staffing costs. So that's the point where we started looking for outside help, which I think a limitation all too often in healthcare is to be afraid to look for outside help because we can fix it ourselves. And in some cases you can, but there's nothing wrong with reaching out to other individuals who have some experience and expertise in an area to guide you through realignment or refocus for your healthcare organization. So, with that said, we did in fact bring Altius in, and what stands out to me is I think there are mental models in some cases that consultants are just going to come in and slash and burn. Uh, that has not been my experience with Altius. You all helped us look objectively at our staffing levels, reassigned, realigned, and through the course of time, we were able to eliminate FTEs, but not through layoffs. So just through attrition. So I think it kept the staff nervousness level lower. And I think it portrays a real compassionate image on the part of senior leadership when you can do something like that and still maintain, an engaged workforce. So we were through that, we were able to reverse, our financial fortunes, and along with some other measures that we took as well. But it put us in a strong position knowing that we need to do something more because of physician availability and recruitment and wanting to bring some specialty services to our market. We were able to negotiate not with one particular entity, but we were, able to be an attractive uh, facility organization for many others to, engage in our due diligence process.
Craig, you mentioned a couple points that I want to circle back to about, and I just wanted to talk a little bit about the fact that unfortunately in healthcare, productivity has been weaponized quite a bit. And what I mean by that is, benchmarks have really been used many times as the source for the red line pen of the positions that need to get eliminated. And I do want to just, mention the fact that when we worked with Somerset, it really wasn't about that at all. It was about realignment and understanding where you had opportunities to realign so that you could get into that financial position of strength. Because when productivity is weaponized, it really becomes an impetus for negative and toxic activity across the organization. However, when productivity is put in the right line and it shines a light on all of the areas where you might have access issues, where there might be operational issues, where there might be transformation, now the organization can use it the way that Somerset did as a strategic lens for all the areas where you could improve operations and collaborate a little bit differently.
I'll use one particular service for an example is to staff up or realign services within the case management department. We realized there was a opportunity there to have more aggressive case management and focus on the patient charts to increase our case mix index, and that in turn then led to an overall acute care case mix index growth, which added thousands of dollars in many cases to the average patient stay. So that's an example that sticks in my mind as we realigned. Maybe some services were overstaffed, but we also had some that were understaffed. So we were able to shift those resources around in a very, I think, smooth way, but had really clear outcomes for us financially as well as I think staffing morale wise as well.
What would you say, to maybe leaders that are in a position and they're afraid to look at labor or productivity because their leaders might have too many balls in the air? We've already given them too many things to do. What would be your advice in those situations?
Well, number one, the tools that you provide take a lot of the burden off of the leader because it gives you clear benchmarks and reporting numbers that you can look at on a routine basis. So it gives you an idea of where you're going, up or down, in staffing productivity. But it also, affords you the opportunity to, if in fact you are short in staff, you have a legitimate tool to take to senior leaders and say, this is an area where we think we could staff up and improve service X, Y, or Z. So I never looked at it as a process of creating more work for the manager. I think if anything, it lessens the managerial responsibilities on a day-to-day basis.
I think that's absolutely a great point. I want to transition a little bit into all of rural healthcare right now. I know that you're working in, consulting, you're doing a lot of strategic work. You've, been doing some work in the Midwest. In your opinion, Craig, right now, what do you think are some of the most crucial challenges that the rural healthcare market in general is facing?
Access to capital, access to staff, retention, recruitment and retention. Those would be the obvious ones. Uh, Reimbursement is up there as well. I think maybe the less obvious ones, and I alluded to it a bit, is um, we tend to do tomorrow what we're used to from yesterday. So we're not willing to shift out of what we're used to. Uh, and I think I'll just maybe go back to maybe some of my beginnings in healthcare where I alluded to the break room talk. And so the respiratory service at the time, a lot of the break room talk was this patient doesn't need this treatment, or why are they still on these treatments? And so that led to, and we're very proud of my staff and our medical director for helping us lead this. We created therapist-driven protocols, and we really reduced the number of unnecessary, unneeded modalities, but also provided the appropriate care that led to protocols being implemented into clinical pathways. And that is just maybe a small example of how you can take those whys and turn it into good outcomes. But that also people that live through that then really embrace things like staffing realignment because it's numbers driven. Let's face it, many physicians and people are numbers driven, and so that I think that led to um, embracing that. But back to the other question was, and I think I'll tie it into my growth in healthcare. And I said before that I had some very good medical staff leaders, as well as I had some CEO that was very visionary. He was really the driving force behind us starting new programs within our facility, and he had a good way of creating the vision, then handing it off to you and saying, "I'll make it happen," which was fun. So, how does that tie into rural healthcare? Well, I think we have to continue to look at what we're doing in rural healthcare and not just again getting away from that picture of what we're doing now. We can't change, but what services are you not offering in your community that you could offer? As simple as telemedicine. I see areas in rural healthcare that don't offer cardiology services in the sense they don't do echocardiograms, they don't have a cardiologist available, or pulmonary. And we know our aging population, particularly in the rural markets, those are some of the top DRGs that we treat. So those are maybe the ones we don't think about that we could really implement in rural healthcare to grow the top line. We're so interested in decreasing the bottom line that we sometimes forget about growing the top line.
Absolutely. And whenever you focus solely on the bottom line and cutting costs, you can almost choke your growth, so to speak, into a situation where the organization just gets in the downward spiral and it just becomes a cutting to the bottom, if you will. And I love the fact that you said, what can we be providing? What services might we offer that we're not currently? And what does our community need? Because I think that's where true innovation starts. And some of the most expensive words in healthcare that's the way we've always done it. And in rural America today, in rural healthcare, it's those innovative approaches of what could we be doing? What should we be doing? What are we not doing that our community needs? How can we meet our patients where they are through telemedicine, through, healthcare at home? What are those options? How can we partner with other organizations to really bring rural healthcare to a fresh thinking perspective?
Yes, yes, and and teaming up with other healthcare organizations, whether it be a collaborative sense or even full scale merger, but being giving that access to those specialties into the rural market is I think it's compassionate because so many of those people are above a certain age where they don't like to travel or they can't travel or they have limited family resources to help them do that. So what we can provide on a local level um, is just something that I would consider compassionate quality healthcare.
Can you talk a little bit about some of the work you're currently doing? I know that you're focused on some strategic initiatives in the rural market and bringing those exact types of services to areas that haven't had them before. I know one of your more recent projects deals with orthopedics, and focusing on, the demographic analysis of the communities. Like, what would you do in a rural hospital setting to identify, what they should be doing, what they're missing, what services could they offer to really help a rural hospital take their services to the next level?
The analytics are just critical. Patient demographics, resources. Where our current, let's say your top 10 outpatient diagnoses, what are they? So where are they going? How far do they have to go to be treated, or are they not being treated? Uh, in a good sense. So looking at all those numbers, seeing what the reimbursement model is, what the capability is of that institution to provide that service, understanding limited resources and capital, yeah, I think is a really important first process to work through because maybe, just maybe, you can afford it. But I don't think that's the case in so many ways. You could figure out a way to do that, particularly if you partner up with another provider.
I think that's a great point, is figuring out, how you might be able to bring those services to the community, how you can partner with other providers and really make that vision become a reality. How are the lessons that you learned from Somerset, impacting your current, consulting career and the ideas and things that you bring to the healthcare organizations that you work with? Because I'm sure that your experience there is infused in everything that you do today.
An example that I often reference is in 2002, my CEO at the time asked me to take over a project which would convert our diagnostic cath lab into the state's Pennsylvania first interventional cath lab without open heart backup. And so the lessons learned there were gaining the support of the medical staff, gaining the support of the community, gaining the support of the staff within the hospital. And that did not happen overnight. It was a long process, but I'm proud to say that today it's a very robust program. I think it certainly has saved many, many lives. It's grown into vascular and vascular intervention. Again, the demographics of our community uh, support CAD, peripheral PAD. There's reasons to develop those programs, but I will say it was very stressful in 2002 uh, to make that happen. But the best lessons are the hard ones, and so I think that shaped my how I approach things. Nothing is impossible if you have people around you that believe in the mission.
I love that. And I really like the fact that you focused on making sure that you communicated the message to all the stakeholders, and you realized that those messages weren't going to be communicated overnight, that you really had to have a long-term plan in place. And sometimes over communication and, getting that message across time and time again is the best path forward.
Definitely a learning lesson. Maybe prior to that, there was something of a lesser degree, but we started a inpatient sleep lab. So that was something that we needed to gain physician acceptance. But interestingly enough, we also at the same time had to educate them on what is sleep apnea. So sometimes it's the whole education piece of it that leads up to developing the program. So I think they're, kind of maybe two different examples, but both with equal value and lessons learned.
No, I think that's a great example. And, with where we are right now in healthcare, in 2025, there are a lot of new innovative treatments that are coming on board. And there's a lot of education that comes around with that. When we're looking at what's going to happen in the future, we're just starting to understand the, impact of DNA driven protocols and some of those other, future things that are going to hit. And I think there's going to be a lot of education for all of us. So I think the great example is 25 years ago, most of us didn't know what a CPAP machine was or what sleep apnea was, but now today they're pretty common and pretty accepted.
Are for sure. Yeah, and 25 years ago, having a cardiac cath in a community hospital would have been considered almost a life sentence in some people's eyes. But today it's just a standard of care.
Exactly. And I think we're going to see things shift and change at a level that we haven't seen, especially as AI, comes into the forefront as well. Because I know saving rural healthcare is one of your passions and you really want to focus on that. Let's say that there's a CEO or COO or CFO sitting in a, small critical access hospital or small 40-bed acute care facility, and their hospital has hit the list, or they know that they're losing money, or they're in an extreme situation. What advice and counsel that would you give to them, or what encouragement would you give to them to the day, or words of wisdom?
Understand your staff, understand your community, understand your market. Too often we do firefighting, and then the fire goes out, and then we're happy, and then it pops up somewhere else. But uh, understand all of your reasons for being in business, and then do not hesitate to reach out to the experts and get some advice. Uh, CEOs think they have to be the answer to all the questions and the answers. They should be the facilitator. We're not putting that role because we understand everything, but we're putting that role because we can connect the dots. And too often we don't do that. So I would say consult the experts, understand your book of business, understand your demographics, and make sure you understand what your staff and community is really needing in the form of healthcare. You can't be all things to all people. We know that, right? But there are certain things that you can provide in your community that are really value added uh, to the hospital as well as to the community at large.
Great advice. I think consulting the experts is really important because sometimes you cannot see outside of the frame. If you're living your day-to-day experience and you're going through the schedule and the calendar and the motions, you can't necessarily see what you don't see. And the outside expert bring an external set of eyes in and can give you perspective and automatically can bring best practices to the table and allow you to pivot and see areas of opportunity that were right in front of your eyes, but you couldn't see. So I think that's great advice. And one of the areas that we've been getting a lot of positive attention on lately is the concept of labor coaching. And, really that's what we did with Somerset is working one-on-one with the managers, but it's helping them on the individual level, not just the CEO, but each of the individual leaders to see what they can't see too, and to really make sense of the numbers. And getting that outside perspective is so important in so many places.
I would just add, it's consultants or outside groups. You have to be very cautious of their approach. I sat through some that we spent a lot of money on, and ended up giving us the results we wanted to hear. That doesn't do anyone any favors, other than maybe provides them income. As a CEO sitting there listening to this in a rural hospital, be open to that change because we have, particularly in small hospitals, there are community institutions. There are, I hate the term, but sacred cows within organizations that can't be or you don't want to touch them. But in so many cases, they need to be touched. And I think that's what made us a little bit unique in the sense that we all bought in when we knew this had to change. Sacred cows or not, we were committed to the process.
Yeah, change management is so important, and understanding that everything within the organization may need a change is important. And when you're sitting on the other side of the table, I know that sometimes the reaction is you don't like the message that's being shared. Just
Yes.
consider the possibilities. I mentioned at the beginning of this that Craig is also a minority owner of the Johnstown Chiefs. And so we want to take this to the hockey. For those of you that are hockey fans and as passionate about it as both of us are, yes, Johnstown Chiefs were also many, many years ago the inspiration for the Charleston Chiefs. And if you're a Hanson Brothers fan or, have watched the movie, it's Slapshot, it was filmed in downtown Johnstown. Many of those landmarks are still there, including the arena that it was filmed in. Can you talk a little bit about what may have inspired you? I'd love to hear that story.
Well, there's been different transitions in hockey in Johnstown going back to the Johnstown Jets, and they were really the inspiration for the Chiefs in the movie Slapshot. And then the Chiefs came after the Jets folded. And I don't want to take credit for owning part of the Chiefs. Our team now is called the Johnstown Tomahawks. We're in a different
All
league.
right, there you go.
Uh, so I've always been a really big fan of hockey, and when my life slowed down a bit, the Tomahawks management approached me and asked if I would like to buy a share of the Tomahawks, which at the time seemed like the right thing to do, and it was because it gives me an opportunity to be involved in a game I'm really passionate about.
That's very exciting. And, it's always great when you're able to take one of those things, your passions and hobbies, and turn it into a job of some kind. What are some of the lessons that you've learned being, a part owner of the Tomahawks?
Well, I think hockey is probably the ultimate team sport. Other sports fans might think it's their sport, which well could be. But you see so much in from the recruitment to being the HR side, if you apply that to a hospital, to your coach that you hire, your general manager. Again, you can put those in different levels of healthcare management. And then the team in general. You need to have a great culture and a cohesiveness amongst that group of players, which again is very similar to hospital staff. I think lesson that I've learned from that is recruiting maybe the wrong player that doesn't fit could be destructive to your team. That's probably the chief lesson that I learned, but also I would say secondary to that, as an owner, and I would say maybe that's a board level. You have to be fully committed to your service and your product, and that means defending them in the community. That means providing whatever they need to become successful. Our goal is simply to advance everyone to their next highest level, and that could be coaches, that could be office staff. But we want to be a springboard for that person's career. Don't we believe that in healthcare as well? Losing someone to another organization because it's an opportunity to grow, it's not a negative. That speaks well for ourselves, and so I think those are some of the lessons that come to mind first.
I think that's a great lesson, Craig. And one of the pieces of the lesson I like the most is you mentioned that you have to defend, some of the actions and things within the community and help to really raise the players up to their next level. And what resonated to me with that is within healthcare, when we have employees in our hospitals and organizations and with the hockey team and everything, everyone's a brand ambassador of that organization. All of the Tomahawk players are brand ambassadors for the Tomahawks. And sometimes you have to, defend them within the community or at least make people aware of them within the community. But every single hospital employee is a brand ambassador for that hospital. And, I really like that message that you were sharing there, because that resonated, I think, with what, a lot of hospitals are experiencing, and being there for each of those leaders and each of those employees so that they can find their next passion, their next move. And I think that's the responsibility we all have in healthcare too, is helping all of our employees find what's their next level, what's their next step, whether it's within our hospital or outside of our hospital.
I wholeheartedly agree, and I one of my pet peeves in hospital management was hearing our employees or even our managers talk negatively about another institution. My thought was always we need to talk positive about our institution, and not be maybe raising ourselves up by tearing someone else down. We're blessed in Western Pennsylvania with two major healthcare systems, and others the medium sized. So I think the quality overall in Western Pennsylvania is something that can be a very collaborative venture for everyone versus a competitive. And so, making yourself feel better by tearing someone else down is not something that I agree with.
I agree with that as well. Negativity, toxicity, and complaining, I think all really breeds that environment where you can't have the positive results that you want. What I like to say a lot is productivity produces positive results, but you can't have positive results in a negative environment. And that negative environment can be criticizing others.
Yes.
So if you want more criticism, criticize others. But if you want to actually build your own organization, focus on the positives. So Craig, this has been amazing. Thank you so much for joining us today. It's been fun to talk through, your career from going from the bedside to the boardroom, and then as the owner of the Tomahawks. Are there any last messages you'd like to share with the audience that we haven't touched upon, or maybe a quote or two that you want to leave everyone with?
For me, sometimes when we're in a certain role in healthcare, we don't really embrace the importance of it until you're in a conversation with someone else. And I recently had a conversation that really opened my eyes to what our value is. And I think we diminish our inherent value in healthcare quite often. We get too caught up in the current news of the day or staffing shortages, but we are all called to healthcare for a specific purpose. Don't diminish your calling. That is something that's given to you. Embrace it. I think life in general can be so much better for everyone when we understand that we're here for a mission.
Don't diminish your calling. One of the things all healthcare, employees, leaders, workers have in common is we tend to be service-based and mission-driven, and we went into healthcare because we want to improve the lives of others. So regardless of what's going on in your facility, don't lose sight of the mission and don't diminish your value. Well, thank you, Craig, so much for joining us today. This has been amazing. I would like to encourage the audience to make sure that you're subscribing to the podcast and to Altius so that you don't miss future episodes. Our next episode is going to be an interview with a gentleman by the name of Danny Mobley. He is the owner of Downtime Trace, and he has created the Uber for equipment maintenance. You are not going to want to miss that. It's going to be very exciting. Craig, thank you again for joining me. It's been a pleasure.
Thank you, Stephanie.